Hi, welcome to Numbers Made Incredibly Easy. In this video, we will address the topic of safe dosage administration. Every single nursing student knows by heart the 6 rights of med administration. They are the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. These are the 6 rights of drug administration. But most students, if you ask them about the right dose, they understand the right dose as administer the dose, make sure you administer exactly what the physician prescribed. But it's not always the case, especially in the United States, where the nurse is as liable as the provider, whoever prescribed the medication. The nurse has to make sure that whatever the doctor prescribed in terms of medication is correct. Not because the doctor prescribed it, but because the guideline that come with the medication, the recommendations that come with the medication says that it's okay, it's safe to administer such dose. Now, where do you find the guideline? It can be on the label of the medication. If not, you have a reference, a drug reference guide. You check and you make sure the order is conform, the order agrees with the recommendation. Before you make any other calculation, you decide to administer the medication. Now, the nurse has first to decide whether or not the order is safe. If it's safe to administer, then you proceed with the second step, which is make your calculation and find out how much exactly to administer according to the order. First, you find whether or not the order is safe. Order is safe, number 1. And number 2, you proceed to administer the medication. If it's safe, you administer. If it's not safe, you do not administer. You call the provider for clarification. Because sometimes it may happen the provider is not aware there's a problem. And as I said, the nurse, you are the last resort. If we use the Swiss cheese model, let's say I have this, I have this, and I have these are 3 layers of security, 3 layers of cheese. All right? Each layer has its weaknesses. The weaknesses are holes in the cheese, okay? This layer, this one has holes. This also has holes, weaknesses. The first layer is the doctor, the provider. The second layer is the pharmacist. And the third layer is the nurse. Here we have the patient. If something happened and the doctor orders a wrong medication, a wrong dose for the patient. So this is okay? And for some reason, it gets to the pharmacist and the pharmacist doesn't catch it. It goes right. The nurse is the last layer. If your weakness can be, you think whatever the doctor orders is fine. Or if there was a problem, the pharmacist would have caught it. That's a weakness. If all the weaknesses line up, you see what happens? This adverse action crosses the provider, it crosses the pharmacist, and if you don't catch it, it crosses the nurse and reaches right into the patient. So that's why I say you are the last resort for the patient. You want to make sure you may have your weaknesses, but they don't line up with the providers and the pharmacists. And if you happen to catch any problem that goes through the provider and the pharmacist, so the patient is safe. Otherwise, it's a problem. So, and the whole system is liable. Okay, so let's solve a problem to illustrate what we just discussed. Augmentin 150 milligram PO every 8 hours is ordered for a child weighing 33 pounds. The supply, Augmentin 125 milligram in 5 ml. And the label states children under 40 kilo receive 6.7 to 13.3 milligram per kilo every 8 hours. What do you do as a nurse? So you have an order to administer 100 milligram every 8 hours to a child. The child weighs 33 pounds. So the order 150 milligram PO every 8 hours. And the child, let's say patient, a child weighing 33 pounds. In your supply, you have Augmentin 125 milligram in 5 ml, but the label, the recommendation is to administer between 6.7 to 13.3 milligram per kilo every 8 hours if the child is less than 40 kilo. So let's see what the decision is. First, to find out whether or not the order falls between the recommendation, you need to bring your order within these numbers. So we have two numbers here. We have a kind of range with a low number and a high number. Using unit analysis, let's see what the weight of the child is in kilogram, because the recommendation is in milligram per kilo. Let's see in kilogram how much the child weighs. The child weighs 33 pounds, and we have 1 kilogram for 2.2 pounds. Okay, so we cancel pound, all right? Pound on top is at the and at the bottom, so pound cancels out. We have 33 times 1 is 33, divided by 2.2 equal 15. 15 kilo. So this is the child weight. Now we're gonna use the child weight for the low and the high dose. Find out whether or not the order falls between these two numbers. If so, we proceed. If not, we stop and call the provider. Alright? Okay. Let's say low dose, high dose. Okay? Alright, we're gonna work with both the low dose and the high dose to find out whether or not the order falls within the recommended range. Okay? Now, what's the low dose? It's 6.7 milligram per kilogram for 1 kilo. What's the child weight? The child weight is 15 kilo. All right. Now here, kilogram cancels out. Kilogram and kilogram. I have 6.7 milligram times 15. What's 6.7 times 15 is 100.5. So here, the low dose is 100.5 milligrams. All right? That's the low dose. How about the high dose? The high dose is 13.3 milligram per kilo. So here I have 13.3 milligram for 1 kilo. And the child weight is 15 kilogram. Kilogram cancels out. I'm left with 13.3 times 15, 199.5. So this is 199.5 milligram. So we have the low dose and the high dose as recommended, either by the medication manufacturer or literature. Okay? The low dose is 100.5 milligram and the high dose is 199.5. Now let's look at the order. The order is 150 milligram. Does this number fall between 100.5 and 199? You bet it is. 150 is between 100.5 and 199.5. So this is a safe dose. Okay? I can proceed now and find out how much I'm going to administer to the child. Okay? In milliliter. Again, we use what we've learned in MedCalc. Now, how many milliliter you're going to administer to the child? That's step number 2. Step number 1, we found out that the dose is safe, the order. Now, step number 2, find how many milliliter. We start with the order, 150 milligram. And what we have in our supply is augmentin 125 milligram in 5 ml. Remember, we're looking for ml. So we have 5 ml over 125 milligram. So what's the answer? We have milligram cancels out. We're left with 150 times 5 over 125. So 150 times 5 divided by 125. The answer is 6 ml. So I administer 6 milliliter of augmentin to the child. All right. Thank you so very much for watching, and see you next time.